Dr. Paul here. We're going to talk about congested infants. I had a request to cover this topic. This is a common one. If you have a little baby and they just always seem to be very congested, what do you do? Well, first of all, let me just say this. If your baby can maintain a good latch, assuming they're breastfeeding, or if you happen to be bottle feeding, they can maintain having that bottle in the mouth and just sucking away, even though they're stuffy, if their mouth is sealed around the breast or the bottle and they're still moving enough air so they don't have to pull off and gasp for air, then don't worry about it. Bottom line is, if they can stay latched, they're doing fine. That noisy breathing that infants have is largely because of a narrow passage. Their, small noses have small airways, and just the slightest amount of mucus will cause them to be congested. The other thing that's very common in infants that will add to congestion is reflux. And we've done another video in the past on gastroesophageal reflux, or GER, or some people call it GERD. And what's happening with reflux, and I'm going to show you over at a picture, you've got the contents of the stomach, so food goes down the esophagus, there's the gastroesophageal sphincter, just that muscle that keeps what's in the stomach from going back up. Well, in babies, that muscle is loose. Babies always spit up. Well, think about it. They're spending quite a bit of time laying down, and with gravity, bloops, food's just coming up. Well, some of that food comes right up into their nose, and so there's this little bit of mucus, milk, gastric juices getting into the nasal passages, repeatedly causing congestion. So it may not be a cold that you're thinking, oh, my kid's congested, they have a cold. This could just be a little bit of reflux. So here's the tongue. Food goes past the tongue and then down into the stomach. Well, when it comes back up, look what a straight shot you have into the nose. And this is a big part of congestions in infants. That little bit of reflux going up into the nose. Can infants get a cold, like an upper respiratory infection? Of course they can. They have such narrow passages, the tiniest amount of mucus is going to make them more congested. The question comes up, should I use one of those bulb syringes or some form of nasal aspiration? And I would say generally don't bother. Like I said, if they're staying latched at the breast or they can maintain their latch on the bottle, they really hate having things stuck in their nose. But if you must do it, go straight back as if you're pointing towards the ear. People have the tendency of trying to go up the nose like this and do a brain biopsy. And I'll show you one last time on that picture that really the nose goes straight back. So you if you're using a bulb syringe, you squeeze out the air, you stick it in straight back, and you let go. And you suck that mucus out, get rid of it, air out, in, try again. Nice sound effects, Dr. Paul. Basically, that's it. Try not to suction out the nose. Kids hate it. You're going to irritate the tissue. I've even seen kids get nosebleeds for too much suction. But if they can't breathe or they can't maintain a latch, you might add a little saline, sodium chloride, normal saline. They have different brands of that. Squirt a little in, suction it out. See if you can open up the air passages that way. Thanks for watching. I'm Dr. Paul.